Hi, I'm Chantel Garcia. I will be presenting the first part of my case study. My professor is Wendy Weller, and this is for the course SPCE 638, Section 809. Um, Welcome to my presentation. All right, so let's get into it. I'm going to talk about APAC, and that is the code name I will be using for my client. She is a 12-year-old female. She was diagnosed at the early age of 18 months with autism spectrum disorder. She is considered needing substantial support, much more support, also known as low functioning. She has microdeletion syndrome, seizure disorder, aphasia, and mixed receptive expressive language disorder. Her family has no known history of psychosocial disorders. Her mother does have Graves' disease. That's about it. I want to talk about this because this relates to the task list in the BACB 5th edition task list of reviewing records available data at the outset of the case. Two assessments were done during this time. Earlier this month, I had the honor of doing the ABLS, and my BCBA did the AFLS. The ABLS is the Assessment of Basic Language and Learning Skills. It's recommended for 5 to 10 years old, and the Assessment of Functional Living Skills, the AFLS, is recommended for over 10 years old. AFLS was mandated by the insurance company in order to obtain authorization, and authorizations are implemented and done every 6 months. We also chose to do the ABLS because there's a better breakdown as far as progress goes, of showing skills that this learner has, because she needs more support and she is lower functioning. We chose to show the ABLS in order to show that she is showing progress with direct therapy services. Continuing with the behaviors of concern, I'd like to talk about her functions of her behaviors, of APAC's behaviors. I listed the problem behaviors by its function. If you see self-touching and aggression, I color coded them, one in blue and another one in red. Self-touching is multiply maintained by escape, and it is automatic. Aggression is multiply maintained by escape and tangibles. Everything else, such as self-injurious behaviors, property destruction, and elopement, are maintained by escape. This relates to the BACB task list of describing the common functions of behavior, that is F6. In the behavior intervention plan, responding to these behaviors is really, we're really teaching her functional communication training. We're teaching her to mand for a break and giving her reinforcement when she does mand for break. She's getting more reinforcement for using her words rather than engaging in elopement, property destruction, self-injurious behaviors, self-touching, and aggression. For self-touching, we try to get her to mand for the bathroom or redirect her to the bathroom if she needs it. And then for aggression, we're getting her to mand for a break. So yes. Thank you for coming to my presentation. I saw that in the video. Will if I make a funny face, I may get extra credit. Here's to hoping. Have a good evening. Thank you.